Good morning. I'm David Lim. I'm a healthcare reporter here at Politico, and joining me today are two members of the Health Subcommittee on the House Energy and Commerce Committee, Democrat Representative Jake Auchincloss and Republican Diana Harshbarger of Tennessee, to talk about pharmacy benefit managers, otherwise known as PBMs. Thanks so much for joining us today. I want to kick things off by asking about the impact of the news of this week. The 10,000 people who were fired at HHS. And I was curious, with so many senior staff departing at the department, how does that impact the possibility of bipartisan agreement towards a pharmacy benefit package this Congress?
Yeah?
Sure.
I mean, I think what we just heard explains and crystallizes the arrogance of these bros that have descended on Washington, D.C. I mean, these professional podcasters stand in front of a bunch of career scientists and say, what has science ever done? Oh, I don't know. Science eradicated measles until 2 months ago. Science means that a kid who grows up with cystic fibrosis now has a real chance at life. Science means that women who give birth now don't face a 1 in 5 chance of dying. They can now build families through IVF. Science is core to who we are as Americans, and their excuse for destroying our scientific enterprise with their conspiracy and quackery is because they're the first ones who ever thought that chronic disease was a problem. Michelle Obama 15 years ago was talking about this. Blue cities like New York City and Philadelphia were doing this, and Republicans were saying, don't touch our French fries. But this guy, all of a sudden, he's the first one to ever realize that chronic disease is a problem. We will not take a lecture from people who are based in conspiracy and quackery and who are claiming the moral high ground on corruption when Brad Smith, who is running health and human services for DOJ, is hiring and firing his own regulators. Main Street Health reports to CMS, and he's deciding who gets to be there or not. This corruption and chaos will not stand. The American people will not stand for it. And Democrats are going to draw the contrast.
Do you have a response, Representative?
Well, Jake's on fire today. So, well, let me tell you what we talked about in the committee hearing yesterday. And Jake was there, so was I. It was a health subcommittee hearing. And our chairman absolutely said that we're going to find out what the layoffs were all about, 10,000. We didn't know it. And we're going to find out what the premise was for those layoffs. Now, listen, I've been a pharmacist 38 years. I've done clinical, sterile, non-sterile. I've done functional medicine, anti-aging. I've done everything you can do in pharmacy. And when it comes to evidence-based medicine, that's what we set our research on. And we've been involved with clinical trials and the things that really matter when it brings medication to the forefront. There's a lot of things that we need to do. And I've said this since I've been here for the last 4 years. If I could restructure every 3- and 4-letter agency, I'd do it in a heartbeat. Because there's things in every agency that need to be looked at, that need to be adjusted, that we need to recalibrate to be the most efficient agency that we can be. And what falls under our premise and under HHS is the FDA, the CDC, the NIH, and CMS. Every one of those agencies have faults. And, you know, when we found out that there were 700 different working systems in NIH, for example, and none of them talk to each other, that's a problem. Because how would you ever see and be on the cutting edge of science and evidence-based science if you can't have programs that talk to each other to know what the new modalities are going forward? In the same way with having 27 CIOs or chief information officers in NIH, you can't do it. And as far as, I heard a question that they asked Kelly Means about cutting funding for NIH as far as the administrative portion. Look, the NIH was set up after World War II, and they had to have that huge administration fee to set these teaching facilities and research facilities up. When you scale back to what it should be, the 16% or whatever, they still have the money for the research. Don't go into the fallacy that they won't have money to research, do cancer research and things of that nature. We absolutely keep up with that kind of thing. So We have asked for an inquiry with HHS as far as those 10,000 go, and they were laid off, is what I understand, the potential layoffs, and then they were laid off. But we need to find out. It's just like what happened with USAID. What happened? They got rid of a lot of programs, but the head of that department, who was Secretary Rubio, went through line by line. How many of you have a budget, David?
I have a budget.
You have a budget. You go through line by line, and you know exactly where that money goes. That's all we're trying to say is this a good use for taxpayers' money? Because as representatives, Jake and I both are responsible for those taxpayer dollars. So it's like an audit or oversight.
Right, but
that's what we're doing.
But we're responsible.
Yes, we are.
Congress, Article 1. Nobody gave a mandate to DOJ to take a chainsaw indiscriminately to programs and budgets that Congress authorized and Congress appropriated. Speaker Mike Johnson is not a courtier. He's a congressman. He has a responsibility as the leader of a separate and co-equal branch of government to do his job. I'm not asking Republicans to agree with me on policy. I'm asking Republicans to stand up for Congress as an institution.
Well, remember, Elon Musk cannot fire one person. He cannot take $1. Well, that is our job. He's just bringing those to the surface so we, as a Congress, can make those changes.
It was just reported yesterday that Brad Smith and his assistant, Rachel, have a spreadsheet that no one's allowed to see, including RFK. RFK, by the way, is not running HHS, if any of you think he is. No way. They have a spreadsheet that no one's allowed to see, and they are the ones who determine who gets cut and who gets fired and who gets hired. And lo and behold, Brad Smith's regulators at CMS are the ones who are spared the cuts. But career scientists at the FDA who would have the gall to tell RFK that, actually vaccines work, are the ones who get purged. That is not Congress stepping up and doing its job. We need hearings in Energy and Commerce, bringing RFK, bringing David Geyer, bringing all of these quacks and conspiracists in front of us to lay out the evidence that they are claiming for their mandate to bring back infectious disease in the United States.
Well, we'll have those hearings, I'm sure.
I hope that they will be scheduled because I have seen zero evidence thus far. Yesterday we were doing a hearing on over-the-counter drugs. Great. It's an interesting program. It's not the near-term fire right now that we got to put out.
So going back to the question, we saw PBMs.
What was the question?
We saw a PBM deal at the end of last Congress almost come together. Then Trump spiked that legislation package. I just heard a lot of disagreement between you two over kind of the response to RFK. But do you think that there still is a possibility for bipartisan PBM legislation this Congress?
Not if Elon Musk tweets about it again.
Well, listen, yeah, I do. I think so. And the president's even said that he wants to do PBM reform. Look, you cannot fix a problem if you don't understand it. And being a pharmacist all these years, I've seen this firsthand. I remember when the PBMs first came into existence, and we would slide a credit card machine that had PCS on it in triplicate, and I would mail that in to get reimbursed. And they were there for a fee for service. It has changed drastically to where the vertical integration and who owns most physician practices in this country? United Healthcare. And then it filters from there. How can you have an insurance company who owns the physician practice, the pharmacy, the specialty pharmacy, the PBM, and then the clearinghouse? It is not good health care. And we have less choices. And Jake, you know this, there's 3 PBMs that do 80% of the business in this country. Do you think that's a good thing? Listen, competition makes everything better, and choices make everything better. And right now we don't have that. If you looked at the current FTC reports and what they've uncovered, it's a travesty. It's what I've been saying for 30 plus years. Why did I come to Congress? Because I talked to my congressmen and my senators for 25 years on the Hill. And finally I raised my hand and said, I'll do it myself. And so I came to Congress. And so this is where we agree that we will have PBM reform. Everyone's talking about it. And I think the PBMs are getting a little bit nervous.
Let's talk about your bills. The Pharmacists Fight Back Act and the Patient Before Monopolies Act. My understanding is that the first sought to create a pharmacy reimbursement model that pegged the national average drug acquisition cost and that pegged reimbursement to that. And then it also aims to prevent PBMs from steering patients to pharmacies that they're affiliated with. The second kind of goes off of what you were just talking about, which, from my understanding, would prohibit a parent company of a PBM or an insurer from owning a pharmacy business. Is that a fair characterization of the bills, and are there other aspects that you want to highlight?
I think the overall characterization of the bills is that Representative Harshbarger and I are skating to where the puck is headed. So PBM reform that got yanked at the last minute last Congress, that's kind of, think of that as like the basics of PBM reform, the absolute imperatives, Part D delinking and transparency and spread pricing in Medicaid, the basics. Now, I don't know why Mike Johnson hasn't brought it to the floor. I don't know what kind of clause the health insurance lobby has in him, but he's not doing it. But once we get that done, our bills are what's next, because where we are heading towards is what the big three PBM CEOs are bragging about on their earnings calls, which is specialty steering, which is the fees from group purchasing organizations, and which is their ability to manipulate their markups vis-a-vis independent pharmacies. And so we're getting ahead of those issues with our bill that has NADAC cost-plus pricing and specialty steering bans and GPO transparency. We're the next up.
So I want to ask about that. So it doesn't sound like you think that there's a path for these two bills to be included in an initial PBM package. Is that correct?
I don't know what the path is for the initial PBM package. Mike Johnson will not bring it to the House floor. I mean, it started with a tweet from Elon Musk, but now it's been 3 months, and I wonder, is it PCMA? Is it the health insurance lobbyists? What are they saying to him in his office? Because he won't bring it to the floor. It would pass immediately, day one.
Well, we need to, and we've talked about that, and I've talked to the Speaker about that. And looking at reconciliation, what we're getting ready to do, there has to be a monetary value attached to that. And so we will get that. I just don't know when. And it's one of those things where this is where Jake and I agree, believe it or not. And the next bill, when we talk about the patients before monopolies, when did you ever think I would agree with Senator Warren on anything? But I do, because it's one of those, if you have a PBM or an insurance company that owns a pharmacy, I don't think that's cool. And I think there's a conflict of interest there, that you steer those patients. And, you know, they might be able to come to my pharmacy and get it the first time, maybe twice, but then they have to do mail order. And these mail order pharmacies, people are getting what they think is the right medicine, and then they'll come to me and ask me what it is. So bottom line is we have to do something. And the bill states that if you're a PBM, if you're an insurance company and you own a pharmacy, well, you're going to have to divest. And we'll give you a period of 3 years to do that. And so that's going to be good for the practice. That vertical integration is not a good thing when it comes to health care. You have less choices and it's more expensive because they can charge what they want. And they're trying to drive the independent pharmacies out of business because it's a take it or leave it contract. You are reimbursed whatever they decide to give you, but if you look at the FTC report, you will see that if it's their pharmacy, they get massive reimbursement. If you're an independent, I might lose $100 a prescription, and I can't afford to stay in business if I continue to do that. So this is where we agree.
Let's talk about the other PBM news from yesterday. The FTC, which you just talked about, paused its enforcement action that alleged that PBMs used illegal rebate programs to increase the price of insulin. That happened because the FTC General Counsel said there's a lack of sitting commissioners that are able to participate. 2 of the commissioners are recused, and 2 were fired by the president last month and are suing to be reinstated. What is your view of the FTC's in-house antitrust action against the PBMs, and do you think that this is an appropriate development? I'll start with you.
It's an example of a mischaracterization by DOJ of efficiency as cutting things versus efficiency as high return on investment. When you fire all of FTC and then you can't prosecute corporate greed and malfeasance, okay, maybe you saved some salaries at FTC, but did you get a return on investment for the American public? When you close the Office of Pharmaceutical Quality in St. Louis that tests for toxins in our pharmaceutical supply chain, did you save money on the lease? Yeah, I guess. But then if you have toxins in our pharmaceutical supply chain and you have a massive drug recall, did you get a return on investment for the American public? The conception of what efficiency looks like is so deeply broken and fraudulent that's coming out of DOJ that everything they're doing lacks credibility. Even some of the things that they stumbled to that are maybe a good idea, because they're clearly approaching it from a position of a chainsaw rather than as a, how do we put $1 down and get $10 back for the American public?
But in terms of the FTC's in-house antitrust action, do you think that
I
should
support
proceed?
it, but as you said, they can't do it because they fired the FTC commissioners.
Representative, do you have a response?
Well, I guess when you're elected president, you can hire and fire who you want. I mean, you work at the pleasure of the president. If the bottom line is this.
It's an independent agency.
Well, that's what they say.
Authorized by Congress.
It is authorized by Congress. We've authorized a lot of things that I'd get rid of, honestly, but...
And Republicans can get rid of it from Congress. That's your right. You got the gavel.
Exactly.
You can authorize things, but the president cannot decide from Article 2 to dismantle things that Article 1 authorized.
Well,
that's the separation of powers.
Listen, Jake, I'm all about looking at what they've done and then going back with a fine-tooth comb and trying to figure out, do we need this? Do we not need this? Is it your prerogative to do this? Listen, I'm right there in the same boat. But the bottom line, the antitrust with the FTC, there's going to have to be something done. We are giving up our legislative authority to these agencies, and we shouldn't have done that. We instituted these agencies to protect the American taxpayer, but yet again, we don't legislate on the things that we need to legislate on. If we focused, we could change the way this place works.
So two
and
questions.
That's my goal.
Just to follow up on that.
Yeah.
Do you think that it's appropriate that the president removed commissioners on the FTC explicitly?
I don't know what his reasoning was, but I guess it's up to him as to what he does. And I would like to know why.
We should call a hearing. That's the thing that we can do as members of Congress. We can call a hearing and ask the executive branch, why did you do this? And if you don't give us answers,
I got above, Jake. We had the hearing with the FTC commissioner that was fired, and all she wanted to talk about was she got fired, she got fired, she got fired. She didn't even ask. We asked legitimate questions in that health hearing. But everybody on the other side, it was all about the unjust firing and are you going to sue? That's not, we shouldn't be bipartisan when it comes to that, or partisan when it comes to that. If we have a hearing, we need to be talking about what the hearing is about. And if we want to call a specific hearing, we need to get them in there, and we need to do that.
So will you call for a hearing to investigate the FTC
Listen,
firings?
I can talk to the chairman, and he's already asked them. He's put a request in to find out about the firing.
I don't want, the chairman of Energy and Commerce should not make requests of the presidency. He demands things. That's what happens when you're in Congress. You get to tell the executive branch that they are coming to testify in front of the American public.
When our chairman yesterday said, look, they were angry about that, and then that's when they called and said, look, we need to bring him in. Yeah.
Do you support the FTC antitrust action against the PBMs with regard to the insulin pricing?
Well, we'll see. Yeah, I mean, look, there's manipulation with all these drugs, not just insulin prices. I mean, if you look at their pharmacies, look at the report, the second interim report, and it talked about what they reimburse a retail pharmacy, one of their pharmacies, or maybe a hospital pharmacy or whatever, phenomenally high, from $27 to $9,000 to $26,000.
Let's really quickly jump to another question before we wrap up. I want to ask about Optum Rx, the recent announcement that they would shift to a cost-based reimbursement model over the coming years. They say they're going to try to cut down on prior authorization rates. They also said earlier this year that they want to pass through 100% of rebates negotiated with drug makers to their clients. Do you see these announcements as concessions given the environment, or are they policy changes that you see as legitimate?
No. This is classic rearguard obfuscation, because what they're really going to do is they're going to funnel their profits towards two other sources: the group purchasing organizations domiciled in Switzerland and Ireland, and specialty steering. The whole rebate game is already over. They're already passing through their rebates. That profit pool has already shrunk. The next profit pool, and where Rep. Harshbarger and I are skating to with our bills, is the specialty steering, is the GPOs. So this is a press release. This is not policy.
Yeah, and I agree. I have a Stark Law clarification bill in the Senate, and it's been held up because some specialty pharmacies are balking at it. And it's where oncology drugs, during COVID, you could mail those to the patient. These are oral chemotherapy drugs. Well, the CMS came back and said, oh, wait a minute, we're going to take that back. The patient has to come. You can't get a caregiver. You can't get a family member. The patient has to go pick those up from the oncologist. Do you know what the outcomes are going to be on those patients who have no resource to get back and forth? It's going to be detrimental. And my bill would clarify that. It passed out of committee and out of the House, and it's sitting in the Senate because Specialty pharmacies are holding it up. And that's not right. That is not right. I am not here. I mean, I'm a mother, a wife, a mother, a grandmother, and a business owner, and I didn't come here to waste my time. I came here to change the way healthcare is done, administered, and we're on the path to getting that done. We just got to put our pedal to the metal and push it forward.
As a closing question, let's get your predictions on when Congress ultimately will pass any sort of PBM legislation. Do you have a timeline that you're expecting?
He's in the majority.
Let me look at my crystal ball. Well, soon.
Soon? Reconciliation?
Yeah, soon with an exclamation mark. And it's going to be us that drives the bus, and we're going to have to push that. And, you know, you got to be a little forceful. You got to say, bless your heart at the end of everything. And you know what? They don't know if you mean it for good or bad, and that's what I'm going to go in. And they're going to have to figure out what I mean, and then we're going to have to push it, Jake. Now, I haven't said that to my pal here. I've never said that, and I won't, unless it's a good thing.
This year? Is that what I'm
Yeah,
hearing?
well, let's hope to God that it's this year. We've got a 6-month CR. We have to do reconciliation.
What I can tell you right now is that if Hakeem Jeffries were Speaker, we would have passed this bill already.
I think that's a good place to wrap up. Thank you so much for your time this morning. Next up, we'll have Representative Diana DeGette, who will sit down with my colleague Robert King. Thank you.